Okay guys, so do hair transplants last forever? Can you really take hair from the back of the head and move it to the front and expect to keep it growing forever? Most hair transplant clinics promote hair transplants as a permanent solution, but is that really the truth? In this video, we'll dive into the evidence to see if those transplanted hairs will still be growing strong and healthy in 5, 10, or 15 years' time. So the current mainstream view of baldness views it as more or less genetically determined down to the level of the hair follicle. According to this view, each individual hair follicle comes with a genetically determined timer, a molecular timer encapsulated within each separate follicle. And this timer determines not only when the hair follicle will start to miniaturize, but also how fast. According to this prevailing view, the broader scalp environment, the area between the follicles, is more or less irrelevant. Okay, donor dominance explained. The main argument in favor of this view is the so-called donor dominance. This is a fundamental concept in hair transplants going back to the 1950s. Hair transplants involve moving hair follicles from the so-called donor area, typically the back of the head, to the recipient area affected by hair loss. The recipient area will usually be the frontal area or the crown. The principle of donor dominance states that hair follicles from the donor area are genetically immune to miniaturization, which is why A, you never lose hair in the back of your head, and B, when you transplant these hairs to the recipient areas, they will stay there forever. On the flip side, in men with pattern hair loss, follicles at the top and front of the head are genetically pre-programmed to miniaturize and die at some point. Even if these vulnerable hairs are transplanted to the donor area, they will eventually miniaturize and die. This last point is very important when it comes to hair transplants, because if a surgeon transplants hairs from the back of the head that are outside the so-called safe donor area, these transplanted hair follicles are likely to eventually miniaturize and die. That the transplanted hair follicles will last forever is one of the main selling points of the hair transplant industry. In its marketing materials, you will typically see terms like permanent, forever, and lifetime. The promise being you get a transplant once and solve your hair loss problems forever. Is this true? But in this case, do the newly transplanted hairs really last forever? Is the principle of donor dominance actually backed up by long-term follow-up data? This is something that the mainstream scientific and medical literature hasn't really explored. In other words, there is hardly any research that follows up hair transplant recipients over say 5, 10 or 20 years to test if the transplanted hair really does last forever. One area that has been studied extensively is the immediate survival rates of transplanted hairs. You see, even when a procedure is done to the highest standards and the patient is a perfect candidate, not all transplanted hairs will take and grow. Some follicles will not survive the shock of the transplantation and will fall out over the first few weeks or months after the procedure. This is not in dispute. The critical question is what happens with those follicles that successfully take and don't fall out during the early phase. Will these hairs really last forever, vindicating the theory of donor dominance, or will they also eventually start to miniaturize? One complicating factor is the widespread use of finasteride among transplant recipients. This is because most transplant surgeons will absolutely insist that the patient goes on indefinite finasteride treatment after the surgery. Ostensibly, this is in order to maximize the survival rate of the transplanted hairs, as well as to slow the progression of baldness in the other native hairs. But it would also serve to mask any miniaturization among the newly transplanted hairs. Another complication is that even when the patient starts to thin the newly transplanted areas, it's not always possible to discern which hairs are affected. Is it the newly transplanted hairs or the pre-existing ones? Because if it's the pre-existing ones, then the fact that they are falling out does not contradict donor dominance theory. Well, in 2020, we got the first serious study that attempted to cut through the confusion and answer these questions. The researchers followed up and photographed 112 patients who had undergone FUT hair transplantation over 4 years ago. The patients all had relatively advanced hair loss at the time of surgery between grades 4 and 6. This advanced hair loss ensured that the hairs were transplanted onto a scalp that was more or less completely bald. meaning it will be relatively clear in the event of subsequent hair loss whether or not any hairs that would fall out were transplanted or pre-existing. Another strength of the study was that as baseline comparison, it used photos of the patients 1 year after their transplant. By that point, only the hairs that had survived the initial shock of the transplantation would have remained. At 4 years post-transplant, 91% of the patients showed some degree of thinning in the transplanted areas. Around 8% of the patients had severe hair loss, 55% moderate, and 27% light. Only 8% showed no hair loss in the transplanted areas. In the words of the researchers, quote, "These findings of the reduction in the density of the transplanted hair, even though they were harvested from safe donor area, question the theory of donor dominance." End quote. Recipient site influence might affect the growth and survival of the transplanted hairs. Now, with results like this, you would expect the study to cause an uproar in the medical community. Here, for the first time ever, you have strong evidence contradicting the theory of donor dominance. Believe it or not, nothing actually happened. The study was universally ignored and to this day has hardly been cited by any other researchers. The transplant industry and its professionals just carried on business as normal, with patients being promised, quote, permanent results, just like they always have. By the way, I'm not saying this to knock on hair transplants. Modern technology now offers natural looking results and can greatly improve men's quality of life. The problem is that A, men often have unrealistic expectation as to the long-term results they can expect, and B, they typically don't realize that a transplant is by no means a cure for hair loss. If the underlying root cause of hair loss is not addressed, it will progress to the point where a second transplant will be required and then a third. This is often the maximum number of transplants, as there are a limited number of hairs in the donor area to keep harvesting from. A more plausible alternative. The question is, if the donor theory of dominance is incorrect and the transplanted hairs will continue to fall out, what does this tell us about hair loss? Well, the key takeaway is that the tissue surrounding the hair follicles matters. It is not all about individual hair follicles. There is something particular about the front, top, and crown areas of the scalp, something that sets them apart from donor areas in the side and back of the head that never go bald. We can get a very good idea of what this might be from this graph. On the right side, we see something familiar, the typical progression of male pattern baldness. Lighter green colors show the earliest effective areas, and darker blue shows the later stage ones. On the left is a scientific estimate of the mechanical strain or tension that the scalp tissue experiences. This mechanical strain is a result of the tension transmitted from the underlying connective tissue that sits between the scalp and the skull. Lighter colors show higher tension. You will notice an astonishing correlation with the male pattern baldness graphic on the right. Areas with the highest tension are the first ones to go bald. Those with lower tension bald later, while those with the lowest tension are the last ones to go, if they ever do. What role can scalp tension possibly have in hair loss? Well, we know that mechanical tension on the scalp can encourage the production of certain messaging molecules that are involved in pattern hair loss. On the flip side, we know that relieving this tension through things like scalp massages can improve the expression of certain genes that regulate hair growth, resulting in thicker hair. Scalp tension can also negatively affect blood flow to the scalp, starving the hair follicles of oxygen and other nutrients that they need to thrive. It also contributes to inflammation, which is often very pronounced in men with hair loss. The combined influence of these effects is to set in motion the gradual miniaturization of the hair follicles, and this is a long and drawn out process. The hair follicle gradually becomes smaller and smaller with each new hair cycle, till eventually it disappears altogether. A good explanation of what we see with hair transplants is that the newly transplanted hairs are moved from a low to a high tension scalp environment. All the factors we just discussed then set in motion the gradual miniaturization of these new hairs. But it will still take years for visible miniaturization, as the process is very slow and gradual, just as with the pre-existing hairs which sit alongside the newly transplanted ones. These have simply been exposed to this environment for a far longer time and are already into the advanced stages of miniaturization. Now, I want you to consider how much more convincing this hypothesis is compared to the alternative mainstream view of hair loss. The mainstream view is basically a non-explanation. Why do some hair follicles miniaturize and die? Well, because of unspecified genetic factors. Why are some hair follicles immune to miniaturization? Well, because of some unspecified genetic factors. This is not really a convincing scientific explanation to begin with. And to the extent that it can even be tested, it was already disproved in 2020 with a hair transplant study that we saw earlier. A hair transplanted from the back to the front would eventually start thinning. Whereas if the same hair stayed at the back, it would be absolutely fine, even into old age, as we see with men who have that ring of hair around the back of their head. This shows that the location on the scalp is very important when it comes to hair growth, due to scalp tension and blood flow. It also shows that treatments that remodel the scalp tissues, such as scalp massages and using the Grow Band Pro, make a lot of sense. It's not just about DHT and hair follicle sensitivity to DHT. Overall, I'm a big fan of hair transplants. I think for a lot of men, a hair transplant is a life-changing procedure and one of the best ROI ways to invest their money. But just don't expect those transplanted hairs to last forever if you're not on a preventative treatment like finasteride. You need to fix the underlying cause of the hair loss. Scalp massages have been proven in studies to improve hair growth and hair thickness over time by boosting microvascular circulation to the root of the hair follicle. This can help improve the lifespan of transplanted hairs and native hairs. Scalp massages can even be used preemptively to reduce the need for a hair transplant in the first place, or stabilize hair loss so that a procedure will be much more effective. The Grow Band Pro is a revolutionary device that massages the scalp in a completely automated and hands-free way. You can sit back and relax whilst the Grow Band does all the hard work. So if you're worried about hair loss or about those transplanted hairs not lasting forever, make sure you head over to hairguard.com to learn more about the Grow Band Pro. You can improve the condition of the scalp, making it easier for the hair to grow. Sure, use finasteride, DHT blockers and topicals as well if you like. But don't forget that the scalp condition is also important, and that's where scalp massages and the Grow Band play a really important role. Okay, that's it for this video. Leave a comment or a suggestion for the next video you want me to talk about, and I'll see you in the next video.